Hey everybody, Dr. Leo Krawetz, Healthy Feet Podiatry. I've got a special patient here today. She came all the way from the other coast of Florida, swam around the peninsula, and came here just for a plantar fasciotomy. Isn't that great? But now her foot hurts from all the swimming, but at the same time, it got her a little bit better from all the swimming, but she's still having foot pain, and she didn't really swim here. She came across the state because she's had so many issues. She saw a lot of other doctors over there, didn't get any help, and I saw her probably 6 months ago at one of our other offices, gave her some cortisone shots and orthotics, which she had never had. She got a little bit better, but she's had conservative treatment now for 3 years and not getting better. She's ready to do a plantar fasciotomy, so we're gonna do a plantar fasciotomy today. So what I did was I numbed her up. I gave her a block right here, a posterior tibial nerve block, and you can see there's some epinephrine in there, so you can actually see the white lines going up the leg. And that numbs the bottom of the foot. And then I put a little bit of local lidocaine with epinephrine in this area too to numb her up because I don't want her to feel anything. What I'm gonna do is make a small incision right here. And I was telling my assistant, Jelaine, that normally what we look for, we can see where the plantar fascia attaches because there's usually like a curved, deep skin line right here where it attaches. And on her, she's got a lot of skin lines, so it's tough to tell where the actual attachment is. It doesn't matter anyway. When I do my plantar fasciotomies, I like to go distal to the insertion. So right around this area right here. And I'll bend the foot up. I'll actually dorsiflex the foot to get tension in that plantar fascia. That way I can feel when it's cut. Because all I'm gonna do is make a stab incision here, and we're gonna cut across that plantar fascia, okay? So she's numbed up now. I tested her. We're gonna go ahead and make this incision here. And then I'm going to release the plantar fascia. So I'm gonna test her one more time. First I'll tilt her up a little bit here. And if my hand gets away, just let me know, Jelaine, okay? Let me actually do this first. Okay. And if you feel anything, let me know, okay?
Okay.
Any pain?
No.
She's got thick skin there too. Okay, so I've got it in through the skin, and now I do it by feel, and I'm gonna feel across for that plantar fascia. And I'm gonna actually dorsiflex her foot here. It's a weird angle for me because I'm trying to be able to have you see this. Any pain?
No.
And you can hear that sound. You hear that crunching sound? That's the plantar fascia being cut. And I'm gonna push in here. I can already feel that it's released. And I'm gonna go actually about a quarter of the way across here. And you hear that crunch? Listen closely. Just like celery. I know I compare a lot of stuff to celery, but that's what tendons and ligaments sound like when they're being cut. And I'm going across and I feel it. I actually can feel the release with my thumb here. My left thumb is on that medial band. That's really good right now. You can see, if you look in the arch right here, I'm gonna leave this in here. Look in the arch. You can see there's no more tension here. It's usually like a bowstring right there. And all I'm cutting is that medial band. When I went across, if you look at this angle, I went this way, so I'm actually about that far across, and that's exactly what I want. There's 3 bands. There's a medial, central, and lateral band, and all I cut was the medial band. So I'm gonna do one more swipe across, and this is all by feel to make sure I don't feel any tension there, just to make sure I got it cut. So I'm gonna switch hands here. You okay up there?
Yes.
Okay. And it's nice and soft. There's no crunching. Now I feel a little bit right here. Nope, that's it. It's cut. And then we're gonna go right here on this edge here just to make sure we got it out, and we got it out. And that's it. So now I'm gonna push on this again here. That's completely released. And this is no more tension there. This is great. It's exactly what I want. Not that exciting. I keep saying this at the end of my videos, but again, it's a minimal incision case and you don't see a lot of stuff. The crunching was probably the most exciting part of this. I'm gonna stitch her up, and what I do is I throw a just a skin suture across here, but kind of deep. And I will show you this. And let's see. Can't even see my incision, but we're gonna go real wide here with this suture. And I'm probably gonna throw 2 just to be sure. And you know as well as I do with weight bearing, this is gonna wanna pull apart a little bit. That's why we'll put 2 of these in. This is 4-0 nylon that we're using. Is that right, Jolene? 4-0 nylon that we have?
Yes, it is.
And this is pretty tight right here. Let me get my scissors here to cut this. Again, when I have an assistant, this is much easier to do. So we'll do 1 more stitch here, and then I'm gonna inject her with some local anesthetic and a little bit of steroid so she doesn't get a flare afterwards. The steroid will also help, so it'll cut down on any inflammation that she has there too. But the main thing is she's gonna be in a walking boot just for 1 week with a dressing on her, and after a week, she's gonna be in a sneaker. And she's gonna be walking around with the sneaker and the orthotic that I did for her. This is a real wide stitch here. But she's gonna have that sneaker on, and she should be able to walk around and do most of her activities relatively pain-free. Most people just have a little bit of soreness afterwards. And all they need is either 3 Advil every 8 hours for pain, or, oh, that's not a good stitch. Let's do this one again. Or they can take 2 extra strength Tylenol. And that's all she'll really need. She's gonna ice this down too, 3 times a day for 30 minutes at a time. And she'll follow up with me in a week and we'll see how she's doing. So let me just wipe this off, make sure it's not bleeding anymore. And last but not least, this is the local anesthetic with a little bit of steroid. We're gonna go just along the course of the plantar fascia that we just cut, and we're gonna drop it right here in that area. Do you feel that over there?
Yep.
Yeah, you're gonna feel it a little bit. And that's it. That's the whole thing. So she'll come back in a week. We'll see how she's doing. We'll check in with her in the next month. Hopefully we'll give you an update on how she did with this. Really easy procedure. I don't like to do this as a first line treatment. This is when everything fails, we do the fasciotomy. A lot of people watch these videos and they think, oh, I'm gonna go get this fasciotomy and have this done, but that's not really the order we do this. You wanna do steroid injections first, orthotics, anti-inflammatory stretching, and shoe gear modification before you even consider this procedure. But this procedure does work really well for people that fail at all conservative care. So if you like what you see, subscribe to the channel, and we'll see you again soon. Thanks.